Thank you. It's great to be. So I'm really ready to open this up to questions, and I would invite any and remind me to repeat the question so that the people online can hear it. Yes. So thermography, is that what you said? Yeah. So what is my opinion on thermography as a screening tool? I would say the jury is out. I'm not really up on the research, but I would say that thermography, like a lot of new screening programs, is promoted as safer and hence more effective. I don't know if that's true, and I know because even when I was writing this book, my sister called me and said, "What do you think of thermography?" And I was forced to actually look at the evidence then. This was, maybe 5 years ago, and I couldn't see that there was any major advantage or disadvantage to it. So I really can't give it a strong opinion either way. Yes?
Back to the PSA test, I'm asking if you're familiar with Dr. Richard Ablin and his book, The Great Prostate Hoax. And for the audience, Dr. Richard Ablin is the gentleman who discovered PSA, and he says, PSA is not and was never intended to be a cancer marker. A man's PSA level goes up and down throughout the day depending on his activities. He will say if you have done a jostling activity, your PSA is going to go up. If you rode a bike, if you had sex, if you jumped on a trampoline. So it was never a cancer marker. Men are getting screened, by the hundreds of thousands and being told they have cancer when it's not even a cancer marker.
Yeah, absolutely.
Comment.
Yeah, so yes, he did say that, and he did. He looked at the use of PSA tests in the wider community with horror, as if someone inventing a nuclear bomb would look at the world with horror as well, that this technology that they thought was going to be used for one thing gets used for something completely different. And it's when the inventor of the test himself comes out and says, "Stop doing this," you got to pay attention to that, in my opinion. Yeah. Yes?
My husband just went through all of this, and his PSA had suddenly gone up. But again, there can be so many reasons. So the next thing was that they took samples, and they divided the prostate into 12 sections. And they said that 7 of them, first they made a mistake between 8 and 7, and somehow 8 was a larger delineation and put you into a real fear, and 7, they weren't sure. So they took out his prostate. Mm-hmm. And I'm just wondering, once you get to the point where you have, you put it under the microscope, the samples, what do you judge from that point, whether or not to take out the prostate or take out parts, and also it was done robotically, and the guy said, that's much better, as you're saying.
So it's a good question, but the major question I would ask back to you is that, was your husband offered watchful waiting? Which is to say, yes, we've done a biopsy. Yes, it has this level of cancer cells. Are you prepared to do nothing, and we'll come and test you next year, perhaps the year after, and we'll see if it changes? I mean, and that is increasingly the choice of many men who are told this, because they're now aware that there is this problem with overdiagnosis.
It has gone, they did watchful waiting for 3 years, but it kept going back into the normal area, and then it spiked in a 3-month period higher than it had before. And so then the doctor recommended, because of that, to do these biopsies. But they didn't do the biopsies until it spiked up. But once they did the biopsies and they found the 7 out of 12, then they said you should do it right away.
Yeah. So the prostate is like a gland that's shaped like a golf ball. Well, it's about as big as a golf ball. And they use these needles that go in, and maybe they'll use 12 needles, and they'll stick into this, and then they'll pull out little samples of tissue, and they'll examine them. Well, what if that thing was turned somewhat slightly different, and it went in, and they only got 5? I mean, so the likelihood of 8 being significant, and that being the difference between 8 and 7, to me seems so arbitrary. I mean, we have an obsession with numbers in this country. And if you're, and this is one of the problems of, again, with prostate cancer screening, is that you'll tell someone, oh, we'll do watchful waiting, and then they keep testing and keep testing and keep testing and keep monitoring. And, oh, the number's gone up, oh, the number's gone down. This becomes people's lives. And the question is, how much are you not living while you're doing this? You know, and I don't want to comment on your husband's specific point, but we do the same thing with something as simple as cholesterol. I mean, the first chapter of my first book was on cholesterol. And I'll tell you why, because of all of the activities that we do medically that I think are probably the most harmful to people is that we check their cholesterol level, then we get people to worry about their cholesterol level, then we give them drugs to alter their cholesterol level, and a lot of times those drugs alter other kinds of things in their bodies, their muscles, their joints, and so on. And we can cause a huge amount of unnecessary harm just by telling people, I'm going to measure your cholesterol. I've never had my cholesterol tested, and I won't. I've read the studies. I know what the evidence says around cholesterol-lowering drugs. I think that we cause way too much anxiety and psychological distress in the population with this obsession with numbers. Oh, my cholesterol is this. Oh, it was a 3. No, it's down to 2.5. Oh, now it's, you know, and I have friends of mine who tell me, oh, man, my cholesterol went down. And they obsess about this. And I say, just, why are you obsessing about this? I've told you many times, the likelihood that your life is going to be shortened by your cholesterol level is very, very small. And the chance that the chance that your life is going to be extended or improved by taking cholesterol-lowering drugs is also very small. Stop worrying about your numbers. So this is what I would say to most people who get a number and obsess about it. Yeah. Yes? Oh, sorry, back here.
I have 2 questions. The first one, how is in the most popular magazine in America, there are 20 drugs advertisement when this doesn't exist in Europe?
Yeah.
Second question is, who is really behind the testing industry? Because I discovered in New Jersey, since those machinery are very expensive, very often doctors get together and put together this laboratory, and then they order the test, because that's how they make the money.
Sure. Yeah, so the first question around drug advertising, I tell you, when I come to the United States and stay in a hotel, the first thing I do is turn on the TV, because I want to see the drug ads. I do want to see them. We don't get them in Canada. Drug advertising on TV, well, in any media in Canada, when I say drug advertising, I'm talking about prescription drug advertising. Prescription drug advertising is allowed in 2 countries in the world, the United States and New Zealand. You say, well, why is that? Well, it's because every other country which has a public health system says that prescription drugs should not be advertised directly to the public, because that's a decision a doctor makes. It's one thing to advertise it to a doctor, but to advertise it to the patient, that is somehow unethical. And I think I'm always amazed, by the way, what they're advertising. I saw an ad the other night for an antipsychotic drug, probably one of the most powerful antipsychotic drugs. And they have people like running through fields of flowers, and I'm like, that drug doesn't do that. What is this? And they allow this stuff. And cancer drugs, these very expensive cancer drugs are being advertised on TV. It's just, to me, as a kind of naive Canadian, I'm shocked by this. Direct-to-consumer advertising is a very controversial situation. There's been lots of people who've been lobbying against it. As you know, in America, the pharmaceutical companies are very powerful. They spend $3 to $4 billion a year advertising their products directly to consumers, and they do so because it pays off. Now, your second question about being sent for tests where the physicians who are ordering the test own the lab for which you're getting the test. That happens. It happens, and it's shocking that we allow it. Again, it's like saying, don't ask a barber if you need a haircut. The person who's offering you the test should not also be the person who's taking advantage of your decision to buy that test, okay? We've got this situation, though, which is kind of good, and that is when you get prescribed a drug, largely the doctor doesn't benefit. Now, there's some side points to that and some caveats, but largely the doctor decides what treatment you need, you get a prescription, you go to the pharmacy and fill it out. The doctor doesn't own the pharmacy. Sometimes the doctor owns the pharmacy and tells you which pharmacy to go. But largely, in most major industrialized countries, we have separated the act of writing the prescription from the act of buying the prescription. And that's not the same in every country, but that's kind of a good thing because you don't want the doctor to be saying, oh, take this drug. Though, of course, the doctor might have shares in the company. They might be on a speaking arrangement with the company that's promoting that drug. And in fact, in the U.S., just recently, there have been sunshine laws. Do you know what these are? These are ways for you to find whether your doctor is taking money from the pharmaceutical industry. There is I can't remember the name of it, but there's a website where you can go and you can see how much your doctor has taken from various pharmaceutical companies over the years. That's publicly available knowledge, and that's a new thing. We don't have that in Canada, so we don't know. Yeah. Any other? I think, okay, here and then here, okay?
I was a little bit late, I apologize, but did you say or mention something about dentistry?
Oh, dentistry, don't get me going. So you mean in terms of
all of this?
Well,
Very aggressive
yeah.
and invasive
Well,
dentistry?
No, I haven't examined it, though I have looked at the evidence around various dental procedures because I got kids, right?
Right.
So you take your kid to the dentist, and the dentist says, oh, we got to do an x-ray. And I say, I don't think so. And the dentist says, well, yeah, we could do, we can't see all cavities with the naked eye. We have to go in there. And I say to my son, do you have any symptoms? Do you have any pain or anything? No. Then you're not giving my kid an x-ray, period. Though, it's set up to really sell the power of the x-ray. So this is a screening test. This is a screening test for which you should be asking questions. Mm-hmm. It's a simple one, and it's fast, and it's probably not that harmful. But he's a 12-year-old kid. I mean, should he be getting x-rays twice a year for the rest of his life in his mouth? I know when they do the x-ray, the hygienist goes and stands behind a LED screen. That gives me some signal something's going on there. Yeah, no, I'm not an expert on dentistry, but things like that, like dental x-rays, we all should be asking questions. If you don't have any symptoms, what kind of fishing expedition is this? Mm-hmm. And in Canada, you have to buy private insurance in order to get your dental, you get it through your employer. And guess what? There's a good chance that if they tick the box that you've had the dental x-ray, then they charge the insurer an extra $50 for what? 5 seconds worth of work? It's pretty good money, So I'm very skeptical about, as you could imagine, promising that, there could be some hidden disease, and there might be for some conditions. Apparently, if you've got a crown, there can get, the bacteria can develop underneath it, and it might be something for which you would need an x-ray. But a normal kid with a healthy set of teeth, yeah. And don't get me going to orthodontics, because orthodontics is another, I'll have every orthodontist in the world wanting to put a hit on me. Yeah. But no, I mean, we've been through that with our kids with the, your kids' teeth are not coming in properly, they need, and so on, and then the $6,000 bill, and yeah.
But also, I was going to tell you that I'm a dentist, but I am in your side. Yeah. No. And secondly, yesterday, I only do outreach and education. I am represent a foundation called Holistic Oral Health, and we only, in this people's side, no? And I stepped down from that because I didn't know better when I couldn't believe that they were alienating me to do dentistry, not to avoid it, to work for those friends, the drug cartel.
Yeah.
And then just the day before yesterday, I have I had a second opinion for a 3-year-old who was going to be put down because he had a lot of cavities, and he was a cooperative patient. And then I say, wow, that many cavities? And then I say, can I pick on your teeth? And he went, you're just in front of me. That proved that he wasn't an uncooperative patient, and I picked, and he had no cavities.
Wow.
It was very sad, very scary.
Yeah, so we had a question here next. Yeah.
Thank you so much, Dr. Cassel. It's so informative, all this information. I have a question. I am one of those patients that runs to screenings before I'm even asked to. So what do we do? What do you say to somebody, not who just runs or does screenings, but like I've had doctors who I've done a colonoscopy, a mammography, a biopsy, I've had those done, and they said to me, or others, that we've saved your life. What do you say to someone like that? Because it is a very difficult position to be in. Let's say you don't see the symptoms, but you do go for a screening, and like you said, they do find things that oftentimes are not anything that doesn't go away with monitoring. But that's like a fine line of like, you know, when a doctor says, I just removed a precancerous polyp that would have allowed you to die in two years, or he doesn't know that for sure, but it's a very hard position to be in as a patient, as a person in society, where it can help you or prevent you. I mean, and then the other thing I was just going to ask you is, what do you do when you do get the surgery, or when they do a biopsy and leave a titanium clip in you, or do things like that? Can that cause future problems, like the actual biopsy itself? Because I've read where certain insertations can actually spread cancers and do things like that.
I actually interviewed a woman for the book who had the titanium clip and had serious problems from it afterwards. And I don't know how rare or how common those problems are, but they do happen, right? I mean, the main thing, whether you're, and perhaps you're more health anxious than a lot of people, and that's not a human moral failing of any sense. But as long as you're going into it with your eyes open, I would say screen as much as you like. If you believe that the colonoscopy is going to find precancerous polyps, they remove them, and that saved your life, do some research on that. And I can guarantee you that no, I can't guarantee, because I said I think the jury is still out on the overall benefit of colonoscopy. But there are a lot of people who have these polyps removed. There's a lot of people who get injured and have perforations and have serious complications just from a simple colonoscopy. I've never had one, but I understand that the process that you have to go through before you take them can be quite shocking. So, you know, as long as you're going into it with your eyes wide open, and again, and this is one of the major points that I make in the book, is that screening is not an emergency procedure. If you're otherwise healthy, right, you have no symptoms, you can live a long time perfectly healthy without screening. You do have time to do research. You do have time to read up what are the possible harms and the downsides and the costs of screening. So it's not a rush. If someone's telling you, get screened now, because don't. Now that's different if you have symptoms. Again, we're talking about perfectly healthy people versus people that have lumps or things that they feel or things that are wrong that they do need to be diagnosed. That's a different category. I'm talking about perfectly healthy people told to get screened. Yes?
My question is there's a lot of deep cleaning coming in dentistry. And, you know, I've been going to dentists for many, many years, got good teeth and stuff, and then they say that you need deep cleaning and charge you thousands of dollars. And then I have a daughter that's about 24 years old. Oh, she needs deep cleaning. And it's like thousands of dollars. And I'm like, wow. You know, in all my life that I've gone to dentists, all my life. I never heard of deep cleaning until I was 50 years old. And then my daughter needs it at 23, so I see more of that coming up. And all they just do is scrape her, and and I looked at how long the procedure takes, like 30 minutes, and we're done. It's thousands of dollars. That's crazy. What's your comment on that?
This is the first time I've heard the expression deep cleaning.
Yeah, deep
so
cleaning.
so
They
maybe
scrape
it hasn't come to Canada yet. But but in terms
See,
of,
I knew it.
I think if what you're talking about is pretty intensive hygienists getting in there and scraping your teeth. That they do that in Canada, and it used to be the dentist would say, once a year you got to come back, and I even bristled at that. Like,
Yeah.
I take relatively good care of my
I
teeth.
floss, I do all that,
Yeah,
yeah.
and I don't have any problems.
No.
If I had problems, I'd be the first guy in the dentist chair. But again, no problems. We come back now every 6 months. Really? It used to be I had to come back every year. Now they're phoning me at home,
Yeah.
leaving messages on my answer machine telling me, Mr. Cassels, you're due for another dental cleaning.
Yeah.
And I'm like, no. Oh.
And then they tell you, we'll do your uppers one time and then come back in 3 months and we'll do your lowers. Because they don't want you to get the big bill in one shot.
So is it $1,000 today for this?
It was a little more, yeah.
Oh,
It's
wow.
crazy. I was like,
I-
that didn't sound right to me.
So I think where I live, we have private insurance. It might be a couple $100.
Yeah, I
And I
know.
think I pay, there's a copay of,
Yeah, I just paid them cash. It was like, it's crazy.
yikes. Any other questions? Yes, sir.
Simple question. In your opinion, is it worth getting a regular yearly physical examination as the entire medical community wants you to have?
That is the best question. So what is the value of the annual physical? Again, I would say that I've looked very closely at the research. In fact, I'm working with some animators in Helsinki. We're developing a video around the annual physical. So the annual physical, you're told, go in, get everything checked out. It's like taking your car to the garage, right? To find if the wheels are wobbling or if the oil's leaking or whatever. Well, I think, again, that has had a major rethink over the last 40 years. There was a very interesting study done in about 1978 where they said, let's look at the value of the annual physical. So 1978, that's 40 plus years ago. Let's look at the value of the annual physical. And they had a lot of independent experts sit down and sort of hash through the evidence. Like, what is the benefit? The question is, so you've got a population of people, and this population does the annual physical. They go to their doctor religiously. This population never goes to the doctor except for they're sick. So they're not doing the annual physical. So then you follow them over time and say, does this population do a lot better than? No, there's no difference. And so they concluded from this study that there is very little benefit to the annual physical. So I would say that, but I would put that with sort of brackets around it, that again, if you have any concerns, any lumps, any murmurs or anything like that, you should get that checked out. But in terms of being perfectly healthy and thinking that, oh geez, I haven't been to the doctor for a year, I should go. I would counsel against that, because there is a good chance, and this could happen. There's not a good chance. There's a possibility that you're going to get sent for blood work, and the little boxes will get ticked, and you'll end up being screened for something that could radically change your life. And that won't happen if you don't do the annual physical. Yeah. I went in with a broken hand. This was a couple of years ago. I fell and broke my hand. And the doctor started taking my blood pressure. And I'm like, what's that for? He said, well, there's now a fee item for that. We can start checking blood pressures for younger and younger men. Okay. It had nothing to do with yes. So. Do you want us to speak into the microphone?
If you are they are prescribing something that it has to be interacting with it. If you have a high blood pressure, for instance, or diabetes, they have to know exactly which anti-inflammatory or painkiller are going to, because of the interaction, medical interaction. That's only, maybe because of that.
Going to see your doctor because you have a problem with the drugs you're taking, That I mean, you might be perfectly healthy. That might be a perfectly good reason to go and get another a second look. Yes, Joanna.
Thanks, that was really interesting. I just wanted to highlight the sort of political and psychological aspects of this. So when I've been looking at the history of psychiatry in the 19th century, a big motivation for building all the asylums was the idea that if you got to people early and got them into treatment in the asylums, you'd make them better, and you'd really just get rid of the problem of madness or insanity or whatever they called it in those days. And of course, within sort of 20 or 30 years, the asylums just filled up with more and more chronic people, and it was quite clear this wasn't working. And then again, when they got rid of the asylums in the 60s, they promoted that as being good for early intervention, because the asylums were stigmatized. Now we'll treat people in the community and be able to get to people earlier. And then recently we've had the early intervention in psychosis movement, which again, it was the idea that if you intervened early, you could change the course of psychosis or schizophrenia and people wouldn't become chronic. And they've done several trials which show that's absolutely not true. You might help people a bit while you're helping them, while they're getting lots of resources and lots of support, they do a bit better, but it makes no difference to long-term outcome. And of course, this resulted in, and part of the idea behind this movement was to try and get drug treatment started earlier, and the pharmaceutical companies supported the early intervention conferences and academics and research and all that sort of thing. And that was, their idea was that if you started the drug treatment early, it would prevent the decline in the brain damage that's caused by psychosis and schizophrenia. And now it's starting to come out and starting to be recognized that actually that brain damage, that brain shrinkage that was demonstrated in people with that diagnosis
Caused by the
was
drugs.
all in people on drugs and was caused by the drugs, exactly. Yeah. But I suppose the main point I just wanted to make is it's such an appealing idea. Back in the 19th century, it was this idea that the asylums would prevent or treat or cure mental illness if you got there early enough. That stimulated this huge asylum building program, which was one of the biggest public expenditure programs ever, undertaken in the UK and the US as well. So it's so appealing. Governments just love the idea that you hand out a little bit of money and you can prevent all these future problems. But as you've said,
Yes.
it's just not true.
Yes, and we don't put people in asylums anymore. We let them sleep in cardboard boxes in the streets. I mean, this is typically what happens. This you're right. The drive to be it's an altruistic drive, right? It's not that they're and it's a mixture of the altruism of people who want to help people before they get sick, but also the money, the fact that you can make a lot of money by getting people early and getting them on drugs and treating them and so on. So it's not the altruists against the profiteers, they're working together. And that's why it's so insidious, and that's why these companies and charities are so powerful. They have very well-meaning, very philanthropic people who want to do something for people who are suffering from illness. And they, at the same time, partner with pharmaceutical companies and so on and to advance their agendas. The one thing that we're doing now, which I think we're going to look back as an absolute tragedy, is increasingly mental health screening is coming into schools, and I don't know if you're going to be talking about that, but we're in various cities in Canada, they're instructing the teachers to be almost like mini psychologists to sort of look for signs of, and a lot of times you'll have problem kids. I won't deny that. You'll have kids who live in poverty, who come from broken families and violence and abuse and neglect. And those kids are very troubled. But then to go to the next step, instead of trying to prevent that family breakdown and social breakdown, you say, well, now the kid has depression because we've screened him and he's scored certain points. And then the only thing that you offer meaningfully, you might offer some cognitive behavioral therapy, but typically it's, well, there's a big lineup there in Canada there is anyways, will get you on antidepressants right away. So it's a fast track of taking people who have difficult lives and turning them into patients. And I find this appalling, as opposed to, let's try to do something about the social conditions which gave rise to the kid who's acting up in class, who looks sullen because their parents are fighting all the time or something, you know, that they are suffering. But the suffering is not a chemical reaction in their brain that's been identified that way by the pharmaceutical companies, and therefore the kid is just suffering from a lack of serotonin, and his whole world of difficulty becomes even made worse because now he has to deal with the stigma of having a label and the problems of taking antidepressants. So that ends on a gloomy note. We've got a few more minutes left if anyone else, and if you want to leave early, I'm fine with that as well. So, and I've got some books here if you want to come and talk to me about it. Yes.
Sounds like a little bit of a morbid question, but my husband recently had a hip replacement, and I know they removed the upper part of the femur. I asked the orthopedic surgeon what is done with that bone, and he gave me, you know, some kind of absurd comment. But I was wondering, it's not really related to what we've been discussing, but what is done with that bone? Is it reharvested, cleaned, sterilized to use for bone?
You know, I have no idea. I have no idea. As you know, hip replacements are done all the time. They do cut off a fair bit of bone.
Yeah.
I have no idea what they do with it.
Just
I can't even guess.
Yeah,
I imagine it goes in with other medical waste into some kind of incinerator. I don't.
If teeth can be harvested, you know, if dental tissue can be harvested, cleaned and reprocessed, I just wondering. Yeah, who profits? And I was just wondering what that connection.
So.
They are extracting bunch of, every single orthodontics are saying every case is extraction case because they are getting the bicuspids and they are getting the stem cells.
Yeah. Oh, wow. And well, maybe
I
they are.
have the documentation. I'll forward to you. So you made me a favor to help.
So what you're saying is that my next book should be about dentistry. Then I'll have all the health professionals of the world disliking me, not just a few of them. That one more question down here.
Yeah, I just wanted to bring up the point about the, well, this is Hippocrates. They deal with a lot of issues with health and using sprouts and diet. And that's not what you get back when you get a lot of these screenings. These doctors are not trained to go in that direction. No. They go straight for the diagnosis, the pill, give the kid Ritalin. You know, things in that matter, they'll just go for a pharma before they give them an alternative. And a lot of these screenings that they do, a diagnosis for a PCA that's high may not necessarily be something that has to be, you know, they'll go for a surgery right away. They're going to jump at this. But this man may have time, 6 months, a year, to really try and see if he can change his diet. And with proper guidance, you know, maybe if he takes his PCA a year later, after he's removed a lot of toxins from his body and exercised, maybe did a few treatments, maybe some saw palmetto, people say saw palmetto, but you know, these are the type of things that are not instructed to that person, and they don't give them that opportunity to even realize that their diet's bad, and they are going in a bad path anyway.
Yeah,
But,
I think if you ask most doctors how much nutrition education they got in medical school, they would probably shake their heads and say either nothing or almost nothing. And which is kind of a state of the shocking. It's a comment on our medical system. In fact, where, you know, nutrition wasn't Hippocrates who said food is medicine. Right, but I mean even the Hippocrates, the old guy. So you know the fact that very little of our medical care focuses on nutrition, is, you know, I think most people would agree that's a huge missing piece. I think you'll pick up a few more things at this conference than you will at any other medical conference about the benefits of nutrition. That's not my area. I don't know much about it. Yeah. Yeah, I mean, probably the best example of diet-related health condition would be diabetes, where, you know, vast numbers of people are diagnosed with type 2 diabetes when we know that altering their diet, for the most part, is going to change that. They're going to have to get rid of the insulin, they'll get rid of the drugs. They will, most people will be able to solve their problems with diabetes by altering their diet. We know that, yeah.